We need to build an economy that works for everybody and not just some people. In the wealthiest nation on earth, 46 million of our fellow citizens have no coverage. They are just vulnerable. If something happens, they go bankrupt or they don't get the care they need. But it's just as important that we accomplish health insurance reform for the Americans who do have health insurance. Because right now we have a healthcare system that too often works better for the insurance industry than it does for the American people. I don't believe anyone should be in charge of your health insurance decisions but you and your doctor. I don't think government bureaucrats should be meddling, but I also don't think insurance company bureaucrats should be meddling. No one holds these companies accountable for these practices. And I have to say, this is personal for Lori, but it's also personal for me. I talked about this when I was campaigning up here in New Hampshire. I will never forget my own mother, as she fought cancer in her final months, having to worry about whether her insurance would refuse to pay for her treatment. So if it could happen to her, it could happen to any one of us. And I've heard from so many Americans who have the same worries. One woman testified that an insurance company would not cover her internal organs because of an accident she had when she was 5 years old. Think about that. That covers a lot of stuff. Now, they're only going to cover your skin. Dermatology, that's covered. Nothing else. And that is wrong. And that will change when we pass health care reform. Under the reform we're proposing, insurance companies will be prohibited from denying coverage because of a person's medical history. Period. They will not be able to drop your coverage if you get sick. They will not be able to water down your coverage when you need it. Your health insurance should be there for you when it counts. Not just when you're paying premiums, but when you actually get sick. And it will be when we pass this plan. Paying premiums. But when you actually get sick. And it will be when we pass this plan. When we pass health insurance reform, insurance companies will no longer be able to place some arbitrary cap on the amount of coverage you can receive in a given year or a lifetime. And we will place a limit on how much you can be charged for out-of-pocket expenses, because no one in America should go broke because they get sick. And finally, this is important. We will require insurance companies to cover routine checkups and preventive care, like mammograms and colonoscopies, because there's no reason we shouldn't be catching diseases like breast cancer and prostate cancer on the front end. That makes sense. It saves lives. It also saves money. And we need to save money in this healthcare system. So this is what reform is about. For all the chatter and the yelling and the shouting and the noise, what you need to know is this. If you don't have health insurance, you will finally have quality, affordable options once we pass reform. We will make sure that no insurance company or government bureaucrat gets between you and the care that you need. And we will do this without adding to our deficit over the next decade, largely by cutting out the waste and insurance company giveaways in Medicare that aren't making any of our seniors healthy. Great. Now, before I start taking questions, let me just say, there's been a long and vigorous debate about this, and that's how it should be. That's what America's about, is we have a vigorous debate. That's why we have a democracy. But I do hope that we will talk with each other and not over each other. Because the objectives of democracy and debate is that we start refining our own views. Where we do disagree, let's disagree over things that are real, not these wild misrepresentations that bear no resemblance. Because the way politics works sometimes is that people who want to keep things the way they are will try to scare the heck out of folks. And they'll create boogeymen out there that just aren't real. So this is an important and complicated issue that deserves serious debate. And we have months to go before we're done, and years after that to phase in all these reforms and get them right. And I know this, despite all the hand-wringing pundits and the best efforts of those who are profiting from the status quo, we are closer to achieving health insurance reform than we have ever been. We have the American Nurses Association supporting it. We have the American Medical Association on board. America's doctors and nurses know firsthand how badly we need reform. We have broad agreement in Congress on about 80% of what we're trying to do. We have an agreement from the drug companies to make prescription drugs more affordable for seniors. We can cut the donut hole in half if we pass reform. We have the AARP on board because they know this is a good deal for our seniors. But let's face it, now's the hard part. Because the history is clear. Every time we come close to passing health insurance reform, the special interests fight back with everything they've got. They use their influence, they use their political allies to scare and mislead the American people. They start running ads. This is what they always do. We can't let them do it again. Not this time. Because for all the scare tactics out there, what is truly scary, what is truly risky, is if we do nothing. If we let this moment pass, if we keep the system the way it is right now, we will continue to see 14,000 Americans lose their health insurance every day. Your premiums will continue to skyrocket. They have gone up 3 times faster than your wages, and they will keep on going up. Our deficit will continue to grow because Medicare and Medicaid are on an unsustainable path. Medicare is slated to go into the red in about 8 to 10 years. I don't know if people are aware of that. If I was a senior citizen, the thing I'd be worried about right now is Medicare starts running out of money because we haven't done anything to make sure that we're getting a good bang for our buck when it comes to health care. And insurance companies will continue to profit by discriminating against people for the simple crime of being sick. And that's not a future I want for my children. It's not a future that I want for the United States of America. New Hampshire, I was up here campaigning a long time. A lot of you guys came to my town hall events. Some of you voted for me, some of you didn't. But here's one thing I've got to say. I never said this was going to be easy. I never said change would be easy. If it were easy, it would have already been done. Change is hard. And it doesn't start in Washington. It begins in places like Portsmouth, with people like Laura.